then we will move to item C, and that is employee biometrics testing as related to district insurance.
We sent out a letter to all staff. We'll just give you a copy of this real quick for you to look at. And as we're moving forward with insurance, we got a couple things we need to take a look at. And this is really coming through the district wellness program. And I'm struggling with handing these off. The district wellness program has been around for many, many years here in the district. And typically, we have focused on activities that are going to help increase wellness in our staff. About 2 years ago, probably a little more than 3 years ago, we developed the wellness program that not only encompasses our staff, but also a little bit with our students too. So we have two different areas. We have the student wellness, which focuses on student wellness, and then we have the staff wellness. Well, when we're talking about staff wellness, we're looking at things we can do that are a little bit more, would benefit people a little bit more than maybe a walking program, a little bit more detailed or in-depth program. And we talked about getting some baseline testing done. So as you do things, you can kind of find out do a little bit of better assessment than just weight. Because when we talk about weight and health, that's really not the significant indicator on whether you're healthy or not. And there's a lot of other indicators that are probably better. And weight loss doesn't necessarily correlate to healthy or wellness in an individual either. And we've been looking at this for the last couple of years, and probably the biggest roadblock in implementing a really baseline testing is the cost. It would mean that you'd have to bring basically people from, whether it's our local hospital or Gunderson Lutheran or Skemp or whomever it is, and you would have to pay those people to administer the test. Well, with a program with WEA, and if we have this done by the end of February, they will come in and do this baseline testing at no cost to the district. So we started setting this up on January 23rd. They will be at the high school, and they will be doing baseline testing for all staff. And if staff want to bring their spouses, they can bring their spouses. Now, the next step in this is that if a person like myself had, and I'm not sure the number of risk factors at this point in time, then there is also another step that you could move into, or another program, and that's actually sponsored by Gunderson Lutheran. And if you participated fully through the program and completed the program, those costs would also be offset by WEA also, so there would be no cost to the district or the individual. Biometric testing is done by WEA. The next step is if you had those risk factors and got into a more of an in-depth program to try to eliminate those costs, would be between WEA and the individual. The individual, not WEA and the school district, so there's two separate costs. So we feel this is important for a number of reasons. One, I think this is where individual wellness is heading, looking at improving overall health before they get to become problems. And as difficult as it is for people to, not that it's hard, but just making that step to go have a physical by bringing these folks on site, I think WEA really believes that they can address a lot of issues right up front. And you can see what this biometric assessment is. Basically, they're going to do a finger poke, look at your total cholesterol with HDL, also looking at your blood sugars to a certain extent, and then analyzing basically your height, weight, and blood pressure, and then doing an assessment with one of the professionals from Gunderson Lutheran. And that's a program that WEA has set up with Gunderson Lutheran. So they will be coming again to the high school on the 23rd, but then we'll be setting dates up at each individual building, because if we just set it up at the high school, it makes it convenient for Greg not to go from the district office to the high school and get his finger pricked. So we want to take away
your waist measured.
Your waist measured, whatever it might be. because those are tough things to do, you know, we don't always like to see those results, especially if it means behavioral changes. So we think this is a positive program, a positive step for individual health. It also puts us in a position, we have a health care reform coming up that really begins in 2014. And regardless of what any individual's thoughts are on it, and there's a lot of different thoughts out there on health care reform, that the state of Wisconsin is moving forward with plans to implement that. To what degree and whether it's mandatory that you have to have health insurance, those are separate issues. But health care reform probably is coming, and it's too big of a program really to ignore and wait until 2014 and say, yes, we need to do that. And wellness and biometric assessments will be a big part of that health care reform. And there will be other steps, and I think some of the board members might, I know Judy did, you were at that meeting in the beginning of November, and we talked about health care reform, how it relates to health insurance. And truly, we can make a lot of changes to our insurance programs. We can go out and bid it, we can add deductibles, we can do a lot of things to that, and we probably will have to do some of those things to get those costs down. But in the end, those are really only one-time savings, because if we save that money next year, more than likely, I don't think anybody's seen a decrease in their health care costs unless you've changed carriers or added deductibles. But if you keep the plan the same, typically health care only goes up. So the really only way to really start limiting your increases in health care is looking at wellness for the overall school community and really getting down to the individual level. So that's kind of the premise and basis for our baseline screening. I just kind of wanted to give you an update that we were doing this, taking advantage of a program from WEA, and I don't know if you have any questions or concerns.
I just have something to add. The medical information that they get from the biometric assessment is confidential. I mean, that Gunderson Lutheran has that information, and you know, because of the HIPAA laws, the school district doesn't get individual information on the teachers. So, you know, that needs to, the teachers know that too. That's what's out in the letter.
We tried to outline that in the letter. We
Right,
tried to
yep.
talk about those things. You know, currently right now, we get information from WEA, and you will get from any insurance carrier, and that information comes in an aggregate of the school district based on, you know, emergency room visits, types of illnesses staff might have. Again, not on individual, but an aggregate. So it just gives you kind of a snapshot of where your district is headed at any one time. And the idea that they can take my personal, that Mrs. Zardi could take my personal information, healthcare, and share it with the board really isn't even an issue, because it is covered by the federal HIPAA laws. And to do that would incur, the district would incur probably a lot of damages if they made any decisions based on that. So,
But hopefully with this testing, there may be some pre-diabetic patients that, you know, if they learn about it soon enough, they can make those health changes. I mean, it is individualized. It's up to the individual, but you know, there may be some ways to, you know, kind of deter those kind of illnesses from getting worse if they catch it soon enough, and just some simple tests can check some of those, high blood pressure. So it's good.
Definitely a worthwhile option for everyone to participate in if they can, because it does. It gives you the opportunity to catch something early.
this year it's voluntary, but I think you're really looking at down the road that this will be something that we will just need and expect our staff to do.
Mm-hmm. Do we have any idea what our involvement is so far? How many people have responded?
We just sent the letters out to staff.
4 days ago.
They will be, our wellness committee members from the buildings will be getting the sign-up sheet. I really don't know what to expect, being voluntary, and specifically, it's right after the holidays, so we'll give them at least 2 or 3 weeks to
So WEA is not
maybe
giving us a
work through this.
discount necessarily for providing this or for doing it. No, that's not something that they're doing. They're just providing it for free.
free as a service to us. And it will be an expectation when we go out to a request for proposal or bid our insurance at the next company, so that we're just not doing this as a one-time thing. Great, you got your results, and it's an ongoing thing that people are looking at and kind of having an idea where they're going with their overall health.
And at the meeting, they even said, if you have your physical in the summer, still do the testing,
Sure.
because then you have a comparison. How was I in the summer? Maybe I'm eating a lot of fruits and vegetables, fresh things, but then winter, after Christmas, things shift a little bit, and maybe that's enough to tip you over with the blood sugar or the
We've
blood
seen some
pressure's
of
up
the
in
insurers
holidays.
drop the deductible, like maybe $20 a month if they participated in an event like this. So if a participant in the insurer goes and has this screening done, the insurer then offers the participant a nominal, but still a discount that puts a few dollars into there. Because it benefits everyone, both the insured and the insurer. So at this point, that's not what they're discussing.
Yeah, and I don't, you talk about healthcare reform, and I'm certainly not an expert, but I've heard enough to let me know that this is a big deal, and I think that the future of healthcare, under healthcare reform or whatever it might be, is going to be not that they're not going to cover specific illnesses, but you might start getting, for lack of a better word, taxed on your behavioral habits. So that if you're a smoker, a heavy drinker, or whatever it might be, that those things might start to become an issue.
Chocolate.
Where they have it, chocolate? I hope not.
Judy, were there any previous, when they've done this in other places, were there any concerns as far as our liability insurer needing to be notified that it's happening in our facility? Or do they offer their umbrella? Or
Who?
Well, I guess I'm kind of looking at a scenario in which they did not see something that should have been seen. That's all on them, even though it happened in our house.
Oh, for the testing
Yeah.
that Gunderson does, are we liable if...
They're providing their liability on it, or do we need to notify our insurer that it's happening in our facility?
I would assume they've done this at other places. I don't have an answer
They
for that
didn't ask
question.
us to notify
They
our
didn't
insurer.
ask
Okay.
us.
Normally,
This is something set up through the insurance, it's those teachers that have WEA insurance, like health insurance.
Yeah.
And they're contracting with Gunderson Lutheran, so I would assume that
Gunderson would cover something.
Yes.
And usually whenever you do this sort of point of care, there's some sort of disclaimer with that.
Right.
I mean, it's just a screening test. It's not a...
We don't enter into a contract, we're just
Right.
providing the room.
Right. I mean, normally whenever you have a point of care, something done, it's a screen, and that's as good as it gets. It's not definitive always, so. Any other questions?